particularly excited to bring out Keller Rinaudo, who's the CEO of Zipline, which is using drones in a very interesting way to deliver blood, in this case, although they have bigger plans, in developing countries. So using drones as a delivery mechanism, but not to bring you that new gadget you had to have from Amazon, but something actually life-saving and life-changing. So ladies and gentlemen, Keller Rinaudo.
Hi, Keller.
Thanks.
So I want to talk about what you're doing for sure, but you actually didn't start your business with the idea of delivering blood to Rwanda. You were turning iPhones into robots. Could you briefly kind of tell us, how did you get from turning your iPhone into this cute robot to delivering blood in Rwanda?
Oh man, that's hard to summarize. It's been a really winding path. When we got started, we really had two strong feelings. One was that we thought smartphones were really cool, but we weren't particularly interested because you could build cool apps for them. We thought they were cool because all of these components that were in cell phones make building robots really easy. Or at least it makes it possible to build robots for way less than they used to cost. And the other thing was, when we looked at most robotics companies out there, they're all like military companies building things that kill people, or like engineers working in bunkers building something that's never going to be relevant to normal people. And so we really thought it would be cool to build a company like the Apple of robotics, a company that actually built things for people to use that would make people's lives better.
That sounds awesome. So why aren't you doing that?
Oh, we are. That's how I think about Zipline. But when we got started, I was 23. We had no money. I was living in Tony Hsieh's apartment in Las Vegas. I don't know if you guys have heard about him, but he has all these apartments in Vegas, and so he gave us one. And we had no money, no credibility, so we just started selling these little robots. It was like whatever we could build in a couple weeks. And in the first year, we sold like $1 million worth of robots. It was kind of crazy. We had a little assembly line running. I actually hired my sister, who's here in the audience. She and this ex-UFC professional wrestler were like building robots and shipping them to people all over the world. Kind of crazy. And then as the company grew, we started to really look like, what product could we build that would have a huge impact on the world? Like, where is robotics going to have where is robotics going to be able to save lives and actually push the human race forward? And that's really what led us to Zipline.
And so what are you doing? Oh, sorry.
Oh, I was just going to say exactly. What are you? Are you actually building the drones themselves, or are you a technology platform?
Zipline designs, manufactures, and operates this instant delivery system for healthcare. And so what that looks like is we build these robotic aircraft. They weigh about 20 pounds. It looks like a tiny little transport, like a little cargo plane that you can pick up. And we launch them from a distribution center. They can go out and deliver any medical product within a 75-kilometer radius, and then they fly back to the distribution center. So it basically makes it possible for any healthcare system to provide instant delivery of any medical product to anyone, regardless of how hard it is to reach those people.
So today it's blood in Rwanda, but certainly even before you get too big into the future, you want to be able to deliver snake anti-venom or medicine or whatever to all kinds of places, right?
Yeah, just to put it into perspective, Rwanda delivers 65,000 units of blood a year. 50% of that is going toward moms who are suffering from postpartum hemorrhaging, and then 30% is going toward kids under the age of 5 who suffer from severe anemia due to malaria. So when you need blood, you really need it. Your life is on the line, and minutes are the difference between life and death. But the challenge with blood is that it expires quickly. You have all different types. You don't know what you're going to need before you actually have a patient who's dying. And so what was happening was the doctor would essentially have to drive like 4 hours. They have a patient who's dying. Doctor gets into a car, drives 4 hours to a blood bank, picks up blood, and then drives 4 hours back. Like, obviously, at that point, usually the patient's either stable or dead. And so what this makes it possible to do is they can literally send a text message and then receive the blood 15 minutes later. So it's just a vast simplification of the system. And we launched that a couple months ago. It's much easier, like a picture's worth 1,000 words. If you guys actually, you're welcome to look on my Twitter profile. You can actually see a video of the first delivery of blood by drone anywhere in the world.
We also have a story up on Recode that my colleague April Glazer did. So
you can check it out. I think in like 30 seconds, we'll hear the sounds of robotic aircraft throughout the audience. That's where we started, but already the program has been so successful that the Rwandan government has actually asked us to expand to the rest of the country and expand to all medical products, and then also operate 24/7, which is really exciting because that means that all of the 11 million citizens of Rwanda will be within a 15-minute delivery of any essential medical product they could need anytime, regardless of where they live. Even the people who live in very rural, hard-to-reach villages will have the same access that you have in the city.
And you mentioned,
why Rwanda? I mean, why did you decide that as your launch pad?
There are a couple reasons. The first is that Rwanda is it's a very stable country, but it's highly rural. Like the vast majority of people in the country live in rural places that can be pretty hard to reach. Rwanda, like many other countries in East Africa, the roads are often impassable, especially when it rains. Most roads are not paved. But most importantly, the government is, especially the people in the Ministry of Health, are really innovative. They are investing heavily in technology and healthcare, and they really believe in equal access to healthcare. And so it was kind of a perfect place to start and show what was possible at a national scale.
and I mean, in terms of where this is going, I think people, in the US, we're kind of, we're so used to this doctor-patient model. I go to the doctor if I'm sick. I go to the hospital if I'm really sick. I don't think people fully appreciate this doesn't really scale. Like the rest of the world will never get that system.
That's a great point, and it's hard. It's hard to convey if you grew up in the U.S. and you haven't actually yet been to East Africa or West Africa or some parts of India. Like you just don't know. It is so hard to get around in places that don't have the road infrastructure that we grow up with here and like take as completely for granted. It's like air. It's really hard to get around in these countries, and so you're absolutely right, it doesn't scale, and that's been a major challenge for like 60 years in global public health. We've been trying to use motorcycles and trucks, getting over these impossible roads to deliver medicine. It's incredibly expensive, it's unreliable, and people die as a result. I mean, last year, I think it was 5.2 million kids died because of lack of access to basic medical products in the world.
And telemedicine is going to be a big part of this. I mean,
Yep.
a big part is going to be there will be a doctor somewhere.
Yep.
But you guys come in, like, telemedicine is great if...
For diagnostics, right?
But this is the other half.
Yeah.
And literally, I mean, the idea for this really came from us. I went to Tanzania, and I was talking to this guy, Zach, and he had designed this early warning alert system where he had like 100 health centers, and he had people texting in when they had a patient who was dying due to rabies bite, or they needed blood, or they had been bitten by a snake. They had a patient who was dying, and they don't have the product they need to save their life. And he showed me the database. It's like thousands of names long. And I realized it's a database of death because there was nothing being done in response. It was like, OK, thanks for the information. Now it's being collated and like published.
Right.
But so it was like, my God, like we have half the system. We just need the other half, which is to say, thanks for the information, help's on the way.
Your company just raised $25 million in funding. In fact, it was kind of encouraging because you said in an interview that you felt that it gave you credibility with investors that you had just gone ahead and launched this in Rwanda, which is great because a lot of times investors are like, can you scale and make me a lot of money? And the fact that they were encouraged by your work in Rwanda is great. But tell us a little bit about how your company does make money. How you do plan to sort of continue to grow?
It's pretty simple. You can think of us as UPS if UPS built their own vehicles. So we operate like a logistics service. In fact, we're basically filling the hole that exists because UPS doesn't exist in these markets. Because UPS kind of depends on roads, and we don't.
And they're testing the same thing for packages. They just delivered a package by drone to some island, right?
I think most logistics companies right now have like bought an off-the-shelf quadcopter and done a delivery over like a couple miles in perfect weather once. I can't emphasize enough, because I actually think this is important, because people get really cynical about drone delivery because they've heard like Amazon announced 4 years ago and now like nothing's come of it. And so everyone's like, oh, it was a PR stunt. And that's kind of a shame. I think the reality is that there's a really big difference. Like anybody in this audience could go buy a quadcopter off the shelf tomorrow and like, hot glue a candy bar on it and like fly it 2 miles and deliver it and be like, we just did drone delivery. Like that's not, you can definitely do that. But operating a system at national scale where you're doing, 20 to 150 flights a day in a way that like people depend on with their lives on you and the reliability of the service, and integrating that with an existing airspace is really hard, and that's the reason it hasn't been done
So
before.
what are the odds then that, I hear what you're doing and I'm immediately thinking, I'm Amazon, I'm FedEx, I'm UPS. I go, crap, we did this demo. We have no idea how to scale it. You know, these guys are delivering blood in Rwanda, but they could be delivering, you know, Cabbage Patch Kids for us in whatever market will allow it. How committed are you to staying in the healthcare delivery space versus being acquired by some company and being generically logistics?
So I think, like, the reason I'm so excited and proud to be part of Zipline is that I don't think you get that many opportunities in life to build something that can both be a really important company and do incredible good in the world. And I think it's not one or the other. It's not like, oh, we're doing philanthropy in Rwanda. That's totally wrong. And it's funny, most people assume, oh, if you're operating in Africa, you must be like doing philanthropy. No, like the Rwandan government pays us for every delivery we do, and it's totally profitable for us, and they save money on every delivery. So it's totally win-win.
So the next step could be delivering something else in some other country.
Well, yeah, but what I was just going to say is basically the reality is, in my opinion, there is not that much like desire nor need for me to get my Doritos delivered to my backyard in 5 minutes, or my tennis shoes.
Well, 9 states did just legalize
marijuana. I know. So I was just going to make a joke about that, but no, don't. So, you know, like, people hear that, and that's where the cynicism comes from. They're like, are you kidding me? Like, burritos, like delivering Chipotle burritos to someone, like, this is just bullshit. And I think people have this feeling that, like...
Well, that's a twofer, though, because you could deliver the Chipotle burrito, and then you could deliver the medicine that cures you from the Chipotle burrito.
Right. It cures the, the indigestion. I think, like, the reality is that where this is really needed is healthcare. And interestingly, we've talked to so many doctors across the US who say, and I was really surprised by this, they're kind of like, hey, as soon as you can solve this in, like, Rwanda, you can get started in the US, because we have all the same problems in rural places. So just yesterday, whoa.
It's good luck.
Just yesterday, we were talking to the Navajo Nation, and it's a mini Rwanda in the U.S. Like, all the same healthcare problems, you know, same challenges getting access to basic stuff that we get access to every day here, and the roads are really challenging. So we're going to be focused on healthcare for a long time, and it's not just because we're passionate about it and we want to save lives. It's also because I think the idea that this is going to start delivering burritos as opposed to life-saving medicine doesn't make any sense to me. Mm-hmm. And also a big part of this is community acceptance. And you know, in the US, you talk to people who are like, I don't want that thing flying over my house to deliver burritos to my next door neighbor. But when in Rwanda, we were really worried about community acceptance. And at the distribution center where the planes are coming back from making deliveries, we literally have 200 Rwandans every day who line up on the fence, and they cheer every launch and every landing. It's completely mind-blowing. And they'll stay all day long. And these are people who've never seen a plane before. I mean, they see them fly over at 35,000 feet, but they've never seen one in person. And so not only that, but I was jet-lagged. I showed up at like 5:30 a.m., and there were 12 people there getting good seats. Wow. So, and you go and you talk to them, and you're like, well, what do you think about this? Like, is it crazy? Is it scary? They're like, oh, it's a sky ambulance, which makes so much sense. And so for me, it's like, it's not drone delivery. It's not like Amazon versus Zipline. It's more just like, can we find a use case that makes so much sense that, like, everybody gets it instantly?
Mm-hmm. I know you said you're very focused in the healthcare space, but I had the opportunity to interview Astro Teller recently, who is the head at what was formerly called Google X, is now just X, and worked on Project Wing. And one of the things he said about drones that I thought was really interesting, and people, by the way, had fixated on the burrito delivery. And he was saying, no, I understand why people fixated on it, but it's not just about Chipotle burritos, right? The idea is that drones are going to enable us to transition from an ownership society where people own things to an access society where things are just, you don't own a hammer, you don't have batteries lying around in your house, but a drone can actually just pick them up and drop them off when you need them. Yeah. Is that feasible? I mean, do you see that as being a reality, that people don't own things anymore because of drones?
That's a very Google thing to say, I think. I mean, I just focus, like,
We'll ask you that, Clay.
I think Google gets to, like, you know, when you have infinite money, you get to, like, think 20 years out. We're, like, thinking 1 year out. Like, how do we build something that's going to save lives today, tomorrow, the next day? How do we make sure that we're operating profitably so the business can grow? I think that Google X tends to approach things, and I know we'll get to hear a bit about it in a sec, but I think they tend to approach things from, like, we just want to build, like, the ultimate perfect thing, and we're much more like, we'll build something that just gets the job done today. And that might be unfair. I don't want to generalize, but that I definitely see. I mean, what makes us unique as a company? A, we're the only company operating at national scale. B, we're the only drone delivery servicing healthcare. And C, we're really focused on our customers. Like, we don't care about anything else. All we care about is the patient who's receiving blood. Are they receiving it fast? Is it easy to order? And is it saving their life?
So what do you think Zipline looks like a year or two from now? Are you in more countries? Are you delivering more products? Are you building your own drones? Are you using somebody else's drones? What changes and over what period of time?
Yeah, we're definitely, I mean, as a team, we have about 40 people. We design the flight computer from scratch. We design and manufacture the airframes. We write all of our own flight control algorithms. We write the air traffic control software that allows the vehicles to avoid each other. So we do everything from scratch, and the cool thing about that is we can iterate really quickly. So right now we're designing, manufacturing, and operating a new fleet of aircraft every 4 months. Which, like, take that, Boeing. Which I think is cool, because our goal has always been, like, we want to build planes that are as safe as Boeing, but write software as fast as Facebook. And we're really bummed out by how, like, slow the aviation industry has grown. I mean, basically nothing's happened in the last 50 or 60 years. Since 1960, we're basically flying in the exact same airplanes. The average age of a general aviation aircraft is like 45 years old. It's mind-blowing. It's basically just a dead industry. So I think in a couple years, we're expanding to all medical products in Rwanda. We've heard from just about every other country in East Africa saying they want to implement similar systems. And then also, the Secretary of Transportation of the US was visiting our office, which was kind of funny because we work on a cow farm. And they came up in like a presidential motorcade with Secret Service and Highway Patrol. I don't know if they knew what they were getting into. Like, the secretary was trying to avoid cow patties walking out to the delivery site. But they are basically pulling us into the US, asking us to build similar infrastructure for the US, focused just on healthcare, hard to reach people who are basically being left behind by the system today.
But at the same time, the regulation in the US still has to make still has to change in a fairly significant way for you to operate in the same way that you do there, correct?
The FAA is leaning in, and their goal right now is to just set up, like, let's get started somewhere where it's really obvious. And I think that that's the perfect approach. So we're really optimistic that we'll be able to, again, it's not about, like, we don't have to solve this for the whole country on day one. We just have to say, hey, here's an island where people are dying because they can't get basic access to medicine. Let's serve them.
You guys are obviously focused on this healthcare problem, at least for now. Where are some other areas where you see drones making a big impact in the short term? How is life going to change fairly soon because of drones?
So the team will think this is funny, but I've been obsessed with sperm for the last 2 weeks. I know it sounds weird. So I was talking to the Minister of Trade of Kenya a couple weeks ago at the UN General Assembly, and he blew my mind. He was like, you guys have to deliver sperm. And I thought he was pulling my leg. And then he explained to me that in Kenya, something like 50% of people depend on cattle for their primary means of generating, like, economic value for their families. And the cows are really, really skinny and have pretty poor genetic profiles relative to, like, a Holstein that you'd see here in the US. They look like different animals. And so he was making the point that if you can deliver Holstein sperm to all of these different families, which all live in rural, hard-to-reach places, you could literally increase the economic productivity of 50% of Kenya by like 30 or 40%. That completely blew my mind. And the cool thing about sperm is it's basically like vaccines. It's pretty light, it's cold chain dependent, hard to deliver, expensive. So it's a great example of, like, the future is so weird. You have no idea. I never would have been able to predict sperm, but now that we've gotten started, it makes so much sense.
You mean when you were a professional rock climber, you weren't just hanging from a rock thinking about cow sperm? I can't possibly imagine why not.
Again, that's why I'm like, we just think a year ahead, because who knows, like, past that. Another good example is today we got an email from these surgical teams that are doing heart transplants in Rwanda. And they were making the point that they've done like 300 transplants. They're going to do another 300 over the next year. And each of these patients needs this medicine. I don't remember exactly what it was called, but they need to take this medicine every day for the rest of their lives, or they have a significant chance of dying. But it's impossible to deliver to them in this place. And so they're like, can we use this system? So I think that's a really cool, exciting opportunity, and those are all just in Rwanda. So that's what I mean, like, it's all short term. Like, what can we do just today? I think in a couple of years, you brought up how medicine works in the US. We really think a lot about, even that example you said, you go, you meet a doctor, and you get sick in the US today, you feel like crap, you're like, oh, I don't want to drive to the hospital. So you wait until you're really sick, and now it's like an emergency, and now you're getting into a car, it's not safe. If you have a car, you like drive in, to the hospital, wait in a waiting room with a bunch of other sick patients, finally see the doctor, he gives you a prescription, now you're driving to like CVS to pick up the prescription, and then getting home. It's like, that sucks. It would be way better if you're like, I feel like crap, I pull out my phone, I talk to a doctor in 5 minutes, and then the prescription's delivered to my door 5 minutes after that. I'm in bed in 10 minutes.
Awesome. I think we actually don't have time, but we're going to make time for one quick question if somebody has a quick question. Yeah. I think someone's going to bring you a mic really quick. Great.
Thank you. So you talked about Rwanda, which is a wonderful, stable country in Africa. What about actual war territories like Somalia or Syria? Are you partnering with like Doctors Without Borders, for example, which could have a need for your services as well?
Yeah, we got a call from from the US government yesterday that I wish I could tell you about, but I can't. But suffice it to say, it's really exciting, because what happens in a lot of these war-torn regions is we send humans in and they get killed. And it's a really heroic thing to do, to go into a war zone to try to deliver medical aid, but it's also not necessary. I think in a few years, it will be much more efficient to do this using automated systems that cost a few $1,000s, and it's just so easy, it's much safer. So we think a lot about war-torn areas. And we also, for example, are working with the government of Liberia, focused on epidemic response and Ebola. Our goal is to take them from being one of the worst prepared countries in the world for an outbreak to one of the best prepared countries in the world for an outbreak. And particularly when you think about epidemics, because they are exponential in nature, the cost of addressing it like right away, if you can catch it right at the start, is thousands of times less than the cost of doing what we did on this last go around, which is like we sit on our hands, pretend like it's not happening, and then address it once it's like a full-blown international catastrophe. So we do think about that a lot. The reason that we started in Rwanda and not that is that everybody thinks that what we're doing is stupid and impossible. So we just really wanted to make sure that in the first deployments, it won't fail for reasons other than the technology. Yeah. So we really wanted to pick like a stable place to show it working first, and then there's tons of value for exactly what you raised going into places that are too dangerous for humans in the near future.
Great. Well, thank you so much.
Thank you, guys.